The challenge for me, and I'll be honest with you, in the years I practice, I never found this to work successfully in my hands. In large part, the big question in my mind is, where is the disc? Where is the disc? And where am I going to position and design the device appropriately to seat the head of the condyle into that disc? And so if you read the literature, you find that at best you have short-term success with an anterior position splint. And the key to this whole approach to treatment is the fact that you need to know where the disc is. That and you know, when I look at all these options and I practice them with some limited success, in large part, I think a lot of it had to do with the accommodation of the patient. But the interesting thing is that when we look at the Urbanek splint device, what I've come to appreciate is that it's simple. It's simple. You know, and in essence, what we're wanting to do is really just take the load off the joint. And so you have some concepts, and many of you will come across some of these devices that are often called an anterior deprogramming device or an NTI device. In concept, you know, they are attempting to unload the joint by not allowing posterior occlusion to occur. But there are some shortcomings with the NTI device. It doesn't retain well. It's generally fitted to the upper anterior incisors. Consequently, it's difficult to wear during the night when it's most needful. You know, the forces of occlusion with bruxing are going to be significantly greater nocturnally or during consciousness than they are during the day. And so it's not uncommon for me to have patients come in who have tried wearing it and they couldn't wear it through the night because of the instability of the bite. You will come across variations on devices. You know, we have some of our well-known colleagues like Frank Spear, Hoyce, Tanner, who have variations on that concept and that device to provide anterior occlusal contact with posterior disclusion.